Welcome, everyone. We are glad to have you here today. And this is the Life After Career panel. My name is Beth Maurer, and I'm going to be sharing my story about life after retirement with you today. And we have two other panelists who will be sharing their stories. Later in this session, we will provide an introduction to Medicare from CF Foundation Compass Case Manager, Kellie Howering. And before introducing our other speakers, I want to provide a few housekeeping items for everyone. This session is being recorded and will be available to all registrants after the event on the CF Foundation YouTube channel. You'll be notified by email when session recordings are available. Under the Stage tab on the right side of your screen, you will notice the chat for everyone who is in this session. If you are in the Event tab chat, that is for the full event and not specific to this session. So you want to be on the Session chat tab. We will be taking audience questions during this session. We encourage you to submit your questions at any time in the Q&A box, and we will do our very best to answer as many questions as possible. We have counselors on call, so if at any point you feel overwhelmed by the conversations, please visit the help desk to request a connect with a counselor. We also want to remind everyone of our community guidelines, which each participant agreed to while registering for BreatheCon. Please be kind, open-minded, and respectful of everyone's opinions and life experiences. Keep all breakout and chat discussions confidential. Use your real identity. Do not use malicious or offensive language. And finally, do not ask for or give any medical advice. If you have any technology problems during the session, please visit the help desk. And I am now going to turn it over to Brigette to introduce herself.
Hi, everyone. My name is Brigette. I'm 40 years old, and I was diagnosed with cystic fibrosis when I was 4 years old. I was born and raised in St. Paul, Minnesota, but I live in Tampa, Florida now. And I had a double lung transplant in 2014.
And my name is Beth Maurer again. I am in Vermont. I was diagnosed with cystic fibrosis 7 years ago at the age of 52. I am a former elementary school teacher, and I needed to retire from my very beloved career last year. And it was due to the impact that teaching was having on my health. I was absolutely the last person who recognized that I needed to retire. I fought it tooth and nail every step of the way. And my story is going to involve not only how we adjusted to my change in employment status, but for me, it was quite a mental health journey with some debilitating depression that kicked in due to my seeming lack of purpose in life. So in keeping with the common thread of BreatheCon, this session will have information, and it will also have a mental health outlook to it. Next, I would like to turn it over to my wonderful husband of 37 years, Bob Maurer, because he is here because when I found out that I needed to retire, I was completely and totally shocked and devastated. And while I was busy burrowing my head under the covers, he was the one who had to figure out the nuts and bolts of how our life would proceed. So let me allow Bob to say hello to you all.
Hi, everybody. My name is Bob, as you all know now, and I do not have cystic fibrosis. I'm a spouse of someone who has cystic fibrosis, and I'm here to talk about more of the nuts and bolts things that we've been through the past year associated with Beth's retirement.
And finally, let me introduce Kellie Howering.
Hi, I'm Kellie. I have been with the foundation, specifically with Compass, for almost 2 years now. So if you ever call in, I may be the person on the other line giving you some guidance and reassurance. And I'm here to talk to you about Medicare basics today, because that is sometimes a scary subject to talk about, especially when you don't really have any assistance to guide your way through it.
Okay, and Kellie will be coming back to join us in just a little bit. But first, Brigette, how did you end up deciding to retire?
Yeah, so just like you, it was a very, I guess yours was maybe a little more abrupt. After my transplant, in my head, it wasn't a question that I was going to go back to work. And I did. And last summer, it started to weigh on me, just working a lot of hours. We had been remote at my job during COVID, and then we were required to come back to the office full time. So putting in that time of commuting, it was just very exhausting for me. I also had a slew of doctor's appointments, not only for my CF care, but other issues I've developed from taking anti-rejection meds long-term. And I found that work was kind of giving me that excuse that I was too busy to really address those things. So last fall, I made the very hard decision that I had to stop working so that I could focus on my health and really keep myself going. So probably just like you, it's the best thing to do, but it's still very difficult. I compared myself a lot to people my age, my friends who are booming in their careers and their personal life. So it was very hard, but it was just, I couldn't find that work-life balance, as we all call it, that allowed me to really focus on my health.
Yes, I believe looking back now, my care team provided a lot of subtle hints that they thought working was not in my best interest. I was an elementary school teacher, and having little kids coughing and wiping their noses on you and so forth led to me being in a constant state of exacerbation. I was on nonstop antibiotics for the entire school year and these were the years before COVID. Then when COVID hit and and it was time to shut down that March, I left my classroom never, ever realizing that I wouldn't return. It was a complete and total shock to me. And so it took a few medical teams. It took having a consult out at National Jewish Hospital in Denver, where finally a very excellent doctor sat and looked at me and showed me the impact all these exacerbations were having on my breathing and on my health, and said, "You have to stop teaching now." And I think there was still part of me that didn't believe him, or thought, oh, I'll just take a year and get healthy and then I'll go back to work. But it quickly became very real. And so my first step was disbelief upon deciding to retire. And that was when Bob picked up the slack. So, honey, how did you respond to all of this?
Well, I tend to be a problem solver and, just push through. And so once we came to the realization that you were going to retire and therefore we would not have your income, a lot of financial refiguring had to take place. And some big decisions got made, and none of these were decisions that wouldn't have happened at some point, but they weren't necessarily planned to happen that quickly. So we decided to sell our home where we had raised our 4 children, which was getting to be too big for us anyhow, because they're all adults now. And I believe at that time, the last one either had moved out or was just about to. And so we had to go through a decision-making process about, okay, where are we going to live? Am I going to continue in the career that I'm in now? What are we looking for an environment? What kind of a community would we like to be part of? Lots of specific life detail type decisions. Now, as I said, these are all things that we would have decided on over time anyhow. But I think at the time we were looking at sort of a couple of year to 5-year horizon versus let's do all this right now. So we did. We very quickly got the house ready and put it on the market and sold it and found a new home in a wonderful new community that we're both very happy in. The new home is much more appropriate to being a retired person, being someone older. And so it has a lot of the features and capabilities that you would like in the house that you're not having a whole bunch of little kids in. And on the whole, everything has worked out great and we're both very happy with it. But like any of these transition situations, there's a lot of stress and just dealing with day-to-day stuff. We've always had a very strong partnership, and for a while you were really tremendously unhappy because this wasn't a decision that you made so much as a decision that was forced on you. And when you couple leaving being a teacher, which you're incredibly skilled at, with at that same time all of our children had grown to the point where they didn't need regular care from their mother, a lot of your role and identity got taken away. And so that's been a struggle for you to work through. But we've worked through it together, and you've made a lot of progress, and you keep making progress. So that's that.
Brigette, how do you think retirement has impacted you both physically, from a physical state, and then also from an emotional state?
Yeah, so maybe you found this too, Beth. Physically, it's been great. I've been able to focus first and foremost on my health. So those times when I was working and maybe didn't feel great, I could kind of say, just power through this. And now I have that time to stop and listen to my body and know when something needs attention. Just like you, mentally, it was very difficult. I'm treated for depression and anxiety. Most of my social interaction came from work because I had about 10-hour shifts there. Those were the people that I saw every day. I live alone. So going from interacting with people all day to kind of being in my house was difficult. And I realized I kind of had to shift my focus and find new goals. And I'm sure you went through that too. So again, it's looking back, I'm like, well, I needed to do that for my health, and I'm glad I did. But similar to you, I'm still working through that emotional side. And just, as Bob was saying, that teaching was your identity. My work was my identity too. And I was very good at it. I was very proud of it. So I realized, okay, I've got to find something new.
Right. And I can say that from a physical health standpoint, retirement has been very positive. I am taking much better care of myself. I am much more routine oriented and sticking with my treatment plans and doing all my airway clearance and all of those important things. I focus more on nutrition. I am able to go to all of my appointments. And as so many of you know, we see a lot of specialists as well as our care team. And so just the nonstop balance of appointments was so incredibly difficult during when I was working full time. And so now I'm able to stay right on top of all of those appointments and communicating with my care team. And so that part has been very good for me. Another service or option that both Brigette and I have utilized is the CF Foundation's Social Security Project. I cannot say enough wonderful things about the attorneys that work through the Social Security Project. I did apply and get approved for Social Security disability income, and it is such a arduous process that if I hadn't had the guidance that I had through the CF Foundation, I don't think I would have been approved for it. So if anyone is feeling that their time to stop or pause their career is coming near, I highly recommend that you reach out through the foundation to the Social Security Project, because they really helped me and helped us enormously through that process. Emotionally, I am still working every single day to try to figure out what my new purpose and what my new identity is. As Bob mentioned, we did move, and it's been a wonderful experience in that we are in Vermont, and I love my little house with a view of a mountain. It's fabulous, but creating a new social life when you don't have the option to have colleagues or don't have children to meet other parents at school or extracurricular activities is really challenging. Trying to come out of being completely isolated during the beginning of COVID and trying to carefully calculate what is a safe amount of socializing is a challenge that all of us, I believe, face. And so that's something I'm working on. I am a mental health consumer in that I have therapy weekly, I use medications, I have certain lifestyle things that I need to maintain in order to try to improve my mental health. And that is still absolutely a work in progress. Sharing a very personal story, I am on the planning committee for BreatheCon, and I was so excited about our keynote speaker on Friday evening. Someone who is just an amazing role model for living a full life with cystic fibrosis. And when our speaker started talking about being the best X with CF, being the best accountant with CF, being the best coach with CF, being the best attorney with CF, I had to pause and kind of weep a little bit and think, oh my goodness, I am still coping with the fact that I don't have that professional identity anymore. And what could I possibly be the best at? Because I'm not a teacher anymore. So that is still something that I think emotionally is something that's really important to consider when you are thinking about leaving the workforce. And Bob has certainly had to be the supportive spouse as I have worked my way through this process and continue to do so. I don't know if you have anything else that you can add on that.
Me or Bridget?
Bob.
Okay. Just that through observation, I would have never known previous how much one needs to plan for one's identity post-retirement. And if I was to leave any thought with the audience, it's that be thinking about who you're going to be after you retire, whether you retire the way most people do as a matter of choice, or you retire because your medical team says to you, it's time for you to retire. Be prepared with something else, something new that will work for you.
Bridget, if you were going to give some advice right now, what would you say to people?
Yeah, I think, it's hard in our society because we place so much emphasis on our jobs, on our careers. And I think about that too. I have even a hard time meeting new people because what's the first thing they ask you? Well, what do you do for work? And so I would tell people, I think we're all so much more than our jobs, and we know that, but it's hard to tap into that because your job and your career is so forefront. So I would tell people, you're so much more than your job. And as somebody who's lived with illness their whole life, you're so much more than what you can physically do. And even though all the emphasis is put on kind of what you can do physically, you're more than that. You're a much deeper person. So don't be afraid to explore those parts too. And don't think that ending your career is the end of your life by any means. It's kind of really the beginning to, keep finding out who you are and those passions and just more about yourself.
Okay, we're going to transition here. And if anyone has any questions for anyone on the panel, please feel free to put them in the Q&A box, because we're going to welcome Kellie back into the conversation. She's going to be talking about Medicare. And then after Kellie is done, we will all come back together and answer any questions you might have. So welcome and thank you, Kellie.
Thank you. And thank you for sharing your experiences. That was so eye-opening. I really appreciate it. Okay, I'm going to start. Okay, so I'm going to touch on transitioning to Medicare and doing some introductions to basic Medicare terms and coverage as well. So as you know, I am a part of CF Foundation Compass, and what we are is a personalized one-on-one service that provides people living with cystic fibrosis, their families, and even your providers, and partnering with them to deal with any challenges related to life with CF. So no matter where you are in your journey, Compass can help. As you can see on the screen, we can conduct a health insurance comparison for you. We can verify insurance and any benefit you're looking into. If you're having an insurance issue or a reimbursement issue, we can assist with that. We can connect you with financial assistance or programs for support, and even connect you to get answers to legal questions, and give you resources and coordinate benefits for you if you're starting the transplant journey. And also we share any educational tools and resources for navigating life with cystic fibrosis. And this is just touching on the financial burden of disease management for people with CF. This was explored through the 2019 health insurance study. The foundation funded the study with George Washington University that examines the financial challenges people with CF and their caregivers experience related to their cost of care. So this was collected between July and December of 2019. And it's just, we learned that 65% of respondents concerns about insurance impacted major life decisions. I just bring this up because this provides what we at Compass, the case managers, are hearing a lot. Paying for healthcare is challenging, and there isn't much financial room to spare for some, not all. And meeting basic needs is hard for a huge portion of the community. So I think today the biggest takeaway here is life changes are about opportunities to think proactively about, especially your financial wellness through a health insurance lens. So just to go into what Medicare is and who is eligible, Medicare is a federal health insurance program for the elderly and people with certain disabilities administered by the Centers for Medicare and Medicaid Services, also known as CMS. To be eligible, you need to be 65 or older. And then if you are 65 or younger and receiving disability as well. And lastly, people with permanent kidney failure are also eligible for Medicare. And just to note, there are some regional differences in coverage and services. And then there are two main ways to choose Medicare coverage. There's original Medicare, which is A and B, with the addition of Part D and an optional coverage through Medigap. Or you can choose a Medicare Advantage plan. This is also called Medicare Part C. So this is the parts of original Medicare and just giving you some costs. So Part A is your inpatient hospital stays, skilled nursing, hospice, and home health care. It is premium free if you worked more than 10 years. If you worked less than 10 years, you may pay up to $506 each month. And just to give you an idea, the deductible for the benefit period for Part A is $1,600. And then for Part B, that is your medical insurance. This covers doctors, other healthcare providers, medical supplies, and even some medications delivered through devices and some preventative services as well. And for 2023, the premium is $164.90 a month. And this amount may be more based on your modified adjusted gross income, also known as MAGI. And just to give you an idea, the standard premium for individuals is $97,000 or less for the year, and for joint is $194,000 or less. And the deductible per benefit period is $226. And once you meet that, you will be responsible for a 20% coinsurance. And then just to touch on Part D, the drug coverage, this is an optional prescription benefit, and I'll go into a little more detail as what I mean by optional. These are administered by a private insurance company that are also funded by Medicare, and your choices vary by state and region. So someone living in California will not have the same choices as someone living in Florida. And this also has a monthly premium, which varies by the plan as well. And just to note, if you're receiving disability, you will get the premium taken out of your disability check. And just to touch base on a great pro for Medicare, you can see any provider that takes Medicare. And this is really important if you have a provider that's out of state or if you're going out of state for a transplant as well. Just to touch on, there is no out-of-pocket limit. You're always going to be paying that 80-20%. So some CF services, devices, and medications may have limited coverage, or sometimes there may not be any coverage, unfortunately. So let's go into Part D a little bit more. This is your drug coverage. So when selecting a standalone prescription drug plan to go with your original Medicare, it's really important to investigate what is important to you. The minimum coverage and the maximum deductibles are set by Medicare and Medicaid each year, and each plan has different premiums, copays, pharmacies, and formularies. So it's really important to keep in mind to look at the different drug tiers and the restrictions for the medications you are specifically on, because the formularies are often divided into tiers, and each tier has a different cost. And then for prescription drug coverage, there are 4 stages, and the amount you pay for medication will change depending on the coverage stage. It will affect your cost share amount. And then also, just to keep in mind, if you're looking at a prescription plan, there are restrictions like prior authorizations, quantity limits, and step therapy, along with you can't use manufacturer copay assistance with Medicare. That is something. So if you're getting copay assistance from like Vertex, once you have a prescription plan through Medicare, you no longer can use that service. And then under Part D, there is no cap on prescription drug costs. So people with CF that do not qualify for extra help are required to usually pay thousands of dollars in out-of-pocket costs each year. Now we're just going to touch a little bit on the common coverage of CF medications. Most of the nebulized medications are covered under B, except for albuterol inhaler, a Zopanex inhaler, along with Toby, the Podhaler, and Caistin. That is under D. And then just to note, vitamins and supplements, along with sodium chloride, are not covered under Medicare at all. And just to know, I know most CF medications are under Part D, but some of them are under B. This just makes coverage for CF medications a little confusing. So this is a really good chart to have on hand. So just to note as well, if your drug is not on the formulary, you can request an exception or file an appeal as well. There's a lot more information on the coverage of different medications on cff.org if you want to take a look as well. And just a little bit of a brighter horizon, starting in January, there is a cap of $35 a month on insulins. This is for Medicare and Medicare Advantage plans. The only thing is this does not include insulin pens. It's only the physical insulin. That's the $35 cap. And then also starting in 2025, Medicare Part D will have an out-of-pocket maximum of $2,000. So you'll be able to spread out your out-of-pocket expenditures throughout the year instead of paying the high upfront cost in the early months, which is really great to hear. And now we're going to go into Medigap. I know I touched on that during the What is Medicare and the Parts. So Medigap is an extra insurance coverage for some costs not covered by original Medicare. Just to note, you can't use this with a Medicare Advantage plan. This is also administered through private insurance companies with additional premium as well. And plans are identified by A through N. And I did put a chart there just so you can take a look at what is exactly covered. And just to note, federal law does not require insurance companies to sell Medigap plans to people younger than 65 and on disability. And then also to note, Medigap sold to people who are new to Medicare are not permitted to cover the Part B deductibles. So you can see Plan C and G aren't available to anyone newly eligible for Medicare, but there are different states that may standardize Medigap policies differently, and those are specifically Massachusetts, Minnesota, and Wisconsin. So it's really important to look into seeing what you're eligible for and what the plan will cover. And now I'm just going to go a little bit into the pros and cons of Medigap. A really good pro is they will cover some of the out-of-pocket costs, like your coinsurance for A and B, along with deductibles and excess charges. What I mean by excess charges is that's the difference between what Medicare agrees to pay and the full amount billed by your provider. Some cons is, again, they do not help with Part D drug cost. They will only cover services that are approved under original Medicare. So if Medicare doesn't cover it, the Medigap won't cover it. Also, it doesn't cover long-term nursing home care, dental, hearing, vision, private nursing, and other health insurance premiums. And then just to keep in mind, the Medigap plans also do have an additional premium, which can vary depending on how old you are or where you live. And this is because plans do consider your health history. This is also medical underwriting, or if you have a pre-existing condition that could restrict your coverage or cause the plan to be very expensive. And then just to touch on the open enrollment period for anyone over 65, you have a 6-month open enrollment period when you are first eligible to enroll in Part B. And then anyone under the age of 65 getting disability, just you don't have the same protections nationwide. Sometimes the insurance departments don't extend these protections. But you will still have the 6-month open enrollment period, and you will not be subject to medical underwriting, but each state varies in their rules and regulation. That's just something to keep in mind as well. And then there's Medicare Part C. These are plans instead of original Medicare. It's an optional benefit if you want to choose this over original Medicare. And it basically bundles everything together. You get A, B, and your drug. And it also has some enhancements, like it has dental benefits along with vision and hearing, extended hospital stays. Some have transportation, help to pay for food, and even like a fitness and wellness program. And then just to keep in mind, the cost is Part B premium plus whatever the Advantage Plan premium is. And that does vary, but they usually are very low. And some plans don't even have a premium. And then just to keep in mind, there are provider networks like HMO and PPO. So you do have to keep in mind in and out of network benefits. So just to go into a little bit more of pros and cons, a pro is the monthly premium can be low, and the out-of-pocket maximum is set by Medicare and Medicaid for A and B. So once that out-of-pocket maximum for A and B is met for the year, you'll be covered at 100%. And the Part B drugs do count towards that B out-of-pocket maximum. A con is sometimes there is a limited network. So you do have to take into account if you go to more than one care center, out-of-state care center, or if you're considering a transplant. So definitely review the provider network and the formulary as well. And then also, unfortunately, Part D drugs do not have an out-of-pocket maximum just yet. In 2025, they will. So that's really exciting. So you will be responsible for the drug costs, and those will not apply towards the Part B out-of-pocket maximum. And then I know I've been mentioning a lot, and you're probably thinking, well, how am I going to financially plan for this? What happens when I become eligible for Medicare and I also qualify for Medicaid? So if you have full Medicaid, it'll be secondary to your Medicare, and most of your care related to CF, including transplant related costs, will be covered as long as all of the providers accept both Medicare and Medicaid. And then you may be asking, well, how can I qualify for a Medicare savings program or even extra help? So a Medicare savings program, there's 4 different programs based on income that vary by state. And you can get assistance with one or all of the following, which are Part A premiums, Part B premiums, reduction to your copays, and your cost sharing. And then Extra help is either partial or full that help assist people with limited incomes with their prescription coverage. So Medicare Savings Program is specific for A and B, and then extra help is prescription coverage. And then the extra help will lower your drug copays and may even help with your premium, depending if you're partial or full. And then just to let you know, you're automatically enrolled in extra help if you receive both Medicare and Medicaid, you qualify for a savings program, or if you receive supplemental security income but not Medicaid. And just to keep in mind, I know that Medicare is a complex program and like out-of-pocket expenses can be significant, but really planning ahead can help people with CF and their families make really important informed decisions to manage costs. And then just to touch base, there are nonprofit copay assistance. So if you're over income for any of the programs I just touched about, there is funding that comes from donations from a pharmaceutical company or other nonprofits. And the three most popular ones that are utilized are the HealthWell Foundation, the Patient Advocate Foundation, and the Assistance Fund. The Assistance Fund is unfortunately closed, but you can sign up to be waitlisted. And it's great because you can have public insurance and utilize this copay assistance, but you have to have the medication or the product covered by your plan to utilize the assistance. And then just to keep in mind, there are limits for assistance given each enrollment period, but you can sign up every year. And then I think a lot of people may have the question, well, what if I have an employer plan? Or what if I have a retiree plan? What if I have COBRA? How does that work with Medicare? So this is how different insurance plans work with Medicare. If you have Medicaid, retiree coverage, or TRICARE, they will always pay as secondary. They are the secondary form of payer. And then COBRA will always pay as secondary because it's not deemed as active employer coverage anymore. And then there's family members, group coverage, or your own coverage. It depends on the number of employees and your age. And then marketplace, unfortunately, you can't have a marketplace plan while on Medicare. So once you are eligible to enroll and you have a marketplace plan, you do need to drop the marketplace plan. And then this is how the coordination of benefits go hand in hand with Medicare and your employer plan. So if you're 65 or older and there's 20 or more employees, your group plan pays first. If you're 65 or older with 20 or fewer employees, Medicare pays first. And then anyone under 65 receiving disability, if there's 100 or more employees, your group health plan pays first. And then fewer than 100, Medicare pays first. So this is really important if you want to delay Medicare when you're first eligible. This is something to take into account. So some people with CF, as we just discussed, you may have a spouse or your own plan and you're still working. So if you're actively employed and covered by an employer's insurance plan or have credible insurance through your family members, you may be able to delay, but there are certain conditions under which you can delay A, B, and D. So just to keep in mind, if you are on disability, you cannot decline Part A. You will be at risk to losing your disability benefits. And always when you have another insurance, you need to notify Medicare if you're eligible to delay because they won't know that. And then just to keep in mind, you will receive a penalty if you are not enrolled when you need to be and you delay and you can't delay for some reasons. And they are significant and they do last a long time. And then for COBRA, you can delay Part D, which is the drug coverage, if you have credible drug coverage and your employer can confirm that for you. You need to keep Part A and B because Medicare is going to be primary. You will run into billing issues with the COBRA plan. So it's really important for you to talk to your employer to see if there's any restrictions for your Medicare eligible enrollment. And then just to go into your timeline, this is the most important, I feel is the most important thing to consider. When do I need to start planning for this? So if you're receiving disability, your disability payments begin about 5 months after you are considered eligible. And then there is a waiting period of 24 months for Medicare coverage to start. So that's the waiting period. After this 24-month waiting period is over, you will be automatically enrolled in A and B. And then if you don't elect a drug plan, it will be chosen for you. And if you have no other coverage during this waiting period, you can elect a marketplace plan, and you may qualify for the tax credits and reduce cost sharing until the Medicare starts. If you are turning 65, you have a 7-month window when you become eligible to enrolling in Medicare. And this is the only initial enrollment period you have. It's one time. And I like calling it like the birthday rule. You are eligible 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after your 65th birthday. This is when you can choose to enroll in Original Medicare with a prescription plan and a Medigap if you would like the Medigap plan, or you can choose to enroll in Medicare Advantage plan. So it's really important to mark your calendar for when you first become eligible for Medicare. So this will help you avoid any coverage gaps and penalties. And then I know this was a lot of information, but the key takeaways is really think about what is important to you. Do your providers accept Original Medicare, or do you want an Advantage plan? And if you want an Advantage plan, are your providers in network, especially if you're considering lung transplant or you have to go out of state? Your current, I know it's really hard to do expected health needs, but think about that for current and future. Medications, make sure you look at formularies to make sure your medications are covered. Also take into account your coordination of benefits. How will my plans coordinate with Medicare? And then always look into the eligibility, your enrollment rules, and the penalties. And I know it's really hard to plan out-of-pocket expenses with the unknown, but if you ever need any assistance, that's what Compass is here for. We can help you answer any questions, even guide you into what may be the best decision for you based on your needs. So definitely, if you need some help, definitely reach out to Compass for sure. Okay, thank you very much. That's all I have for today. And I know Brigette recently transitioned to Medicare, so I really appreciate if you would share how your experience was.
Yeah, Kelly, kind of as you mentioned, it's a very overwhelming process and all of the details. I think like a lot of people, my first concern was, am I still going to be able to receive the level of care that I've been getting? And my medications, how is that going to get affected? So I'll just add that definitely CF Compass is your place to start. They helped me tremendously. Another resource I would recommend is if your CF Care Center has a social worker, because there are things, as Kelly mentioned, that differ state to state. So your social worker can help you with that. Also can make sure that your providers support Medicare as well. That was another concern. I actually was heading into transplant and had those questions of now how does that factor in? So I would say definitely start with CF Compass and know that they know all those details related to CF. So don't panic.
Okay, thank you, everybody. That was really informative, Kelly. And Brigette, thanks for sharing your experiences. If we have not already, we will add information in the chat as to how to get in contact with Compass. They are such a wonderful resource for all of us, and for a lot of different things. And now we're going to look at some questions that you have. We've gotten a question about, are there any programs out there that can provide assistance or information finding affordable housing? That is not something that I researched, but Kellie, do you know anything about that?
Yeah, there's definitely the Housing of Urban Development, HUD.com. There is a search tool that can list low-income subsidized housing through a search bar. You put in a zip code where you're interested in living, and they will bring up specific complexes that offer subsidized housing. And you can call them up and see if they have any open units. The only thing with affordable housing, they do have very long wait lists. So subsidized housing may be a better bet because you only pay a percentage of your income to the landlord or whoever owns the complex, and they get money from the government to offset that. So definitely going to the Housing of Urban Development to look into a subsidized housing or even low income. There's a lot of different terms, but affordable housing is usually through a housing authority. And those are very long wait lists, but you can definitely sign up. Some of them some do have openings. It's listed by county. Each public authority has a county associated with it. So that's also, you can go on the housingofurbandevelopment.com and get a list of those as well. So HUD.com is a very good resource.
Thank you. Someone else asked about the daunting task of planning for retirement while you are simultaneously relying on Social Security disability, especially if you weren't able to work a full career before retirement. That is definitely my personal situation. I did not invest enough years in order to receive full retirement through teaching. I'm fortunate that I have a husband who is a full-time teacher and insists for some crazy reason that he's never going to retire. So hopefully we'll have his income for quite some time. I can say that we did consult with a financial planner and spent a lot of time analyzing where we would live, how much we could spend on where we would live, looking at my Social Security income, looking at Bob's income, looking at our retirement needs, etc. So the resource that we used was a financial planner. Bridget, is that something that you've looked into?
So yeah, I'm going to say I'm kind of at the start of all this. So when I was working, I contributed to a 401k. I had to withdraw that money when I stopped working. I was bridging a gap between my private healthcare to Medicare. So I had to pay for COBRA, which isn't the cheapest. So I had to take out my 401k. So now I'm kind of in that place also where I think probably a lot of people around my age were sort of the first generation to be getting older. And I'm just going to be honest and say, my parents were told when I was diagnosed that I wouldn't make it through school age. So I'm not sure I always had that far sight, which of course I regret now, but you don't know at the time. So I think I'm still trying to figure all that out.
Okay. Another question is, if you receive assistance, and this is definitely a Kellie question, if you receive assistance from a copay assistance foundation, do you have to claim that money on your income taxes?
That's a great question. I believe I may have to circle back and get that answer for you, but I believe since it's a gift or a charity because it's donated money, I don't believe you have to claim that on your taxes, but I can definitely find out more information for sure.
Okay. Kellie, if people are curious about more information regarding Medicare, is there also a website that they can access, or is the best first thing to do, or best first step, to be reaching out to Compass?
Yeah, probably the best first step is to reach out to Compass for sure. Medicare.gov does have all of the eligibility and coverage information on there. Even cff.org, if you wanted to search in the search bar, there's definitely a lot of articles that go into detail on Medicare for sure. But if you have any like very specific questions, definitely reach out to Compass for sure.
Okay. And kind of circling everybody back before we do need to wrap things up. Is there anything, I'm thinking about what we either wish we knew before making the decision to retire, or what we would recommend somebody else doing. Bob had mentioned earlier about kind of thinking, really giving thought to what your identity would be when you become a retired person, and when you don't have that occupational identity anymore. Brigette, is there something that you wish you had known, or?
Yeah, I think I would say to my younger self, and to anyone else, that you're not in this alone. I think, living with illness, we very much are, I can do this, I can take charge person. And it's overwhelming for anyone. So I would say, people are there to support you, not only the foundation and Compass, but any family, friends. I mentioned social workers at your clinic, anybody else that you need to reach out to. Just know that you don't have to do it all alone. There's people there who want to help you and want to see you succeed.
And I would echo the same thing. Being a late diagnosis adult, I've only been aware of my CF for 7 years, so I certainly wasn't planning for a CF-related retirement. But Brigitte's absolutely right that there are resources there to help all of us, and going it alone would be incredibly difficult. So reaching out for help is an excellent strategy to use. I want to thank everybody for joining us and for sharing your stories. Before you go, please take the time to fill out the satisfaction question under the poll tab on the right-hand side of your screen, because we'd love to know how you felt about today's conversation. We now have a 15-minute break before we wrap up BreatheCon with slow flow yoga. Thank you again for attending, everyone, and we will see you at yoga.